When we think about modern surgery, we usually think about repair. But what we're looking at today is something else entirely. It's where medicine really becomes an art form. We're talking about a field that's no longer just about fixing what's broken, but about literally creating what was once thought impossible. I mean, really think about that for a second. What if you could rebuild a part of your own body? And I'm not talking about a prosthetic or some kind of off-the-shelf replacement. What if you could literally build a new custom part from scratch? And that right there, that's the revolutionary idea at the heart of this story. It's a whole new philosophy called comprehensive reconstruction. The idea is to treat the body like a system of parts that can be creatively and precisely reassembled to bring back not just function, but form and aesthetics too.
To really get it, let's focus on one of the most important tools we have, the thumb. It's kind of easy to take for granted, but your thumb is responsible for almost half of your hand's entire function. Losing one is, well, it's just devastating.
So, for decades, surgeons trying to rebuild a thumb were kind of stuck. They were facing this really tough dilemma where every available option was seriously flawed, forcing patients and their families into making these really difficult compromises.
So let's look at those old options. You could transfer the great toe, but the new thumb was often way too big, and of course the patient loses a critical part of their foot. The other main option was using the second toe, but that had its own problems. It was usually too skinny, and it could lead to some pretty nasty deformities. So functionally and aesthetically, these solutions just weren't cutting it.
Dr. Charly Chen, who's a real pioneer in this field, put it perfectly. He called it an unsatisfied aesthetic and functional outcome. And it was that deep sense of dissatisfaction, knowing there had to be a better way, that really sparked the search for a new solution, one that required thinking completely outside the box.
And this is where the big shift happens. This led to a totally radical new way of thinking. Instead of trying to replace the thumb with a single part that doesn't really fit, the question became, why don't we build a new one? Build it from the best possible components we can find. That's the core of comprehensive reconstruction. So how do they do it? Well, this new approach is completely modular. It's like surgeons can now pick and choose the absolute best parts for the job. They'll take a thin flap of skin and the nail from the great toe while preserving the toe itself. Then they'll go to the second toe and harvest a living, moving joint. And finally, they'll craft a custom bone structure to hold it all together. It's literally like building with biological Lego bricks.
Now, the secret ingredient that makes all of this work is something called vascularized tissue. And the easiest way to think about it is like this. You're not just moving a dead piece of bone or a joint. You're moving it with its own plumbing still attached, its own arteries and veins that keep it alive. This allows it to heal and even grow in its new home.
This idea led to a massive paradigm shift. You see, surgeons used to treat bone grafts like they were just a dead scaffold. But Dr. Chen and his colleagues proved that if you handle that graft like the living tissue it is, and this is crucial, you don't wash away its vital cells, it heals directly. It becomes a living, breathing part of the body. That is a total game changer.
Okay, so that's the theory. But what does this artistry look like in action? Let's dive into one of the most challenging cases you can possibly imagine. Something called a floating thumb.
So this is a congenital floating thumb. It's a condition where a child is born with this tiny little digit that's only connected by a stalk of skin. There's no functional bone, no muscle. For a child with this condition, the chances of having a working thumb were traditionally pretty bleak. Now, the standard solution for a long time was a procedure called policization, basically amputating the floating thumb and then moving the index finger over to take its place. But as Dr. Chen points out, for so many families, the idea of sacrificing a perfectly healthy finger, well, it's just not an acceptable choice.
So what they came up with was this unbelievably elegant solution. They build a new, completely functional thumb from scratch using a vascularized joint from the second toe. But here's the absolute genius part. The second toe itself is completely preserved. And that tiny, non-functional thumb skeleton, they actually move it to the foot to give the toe its structure back. So what's the result? 10 fingers and 10 toes. No compromises.
And listen, this isn't just some one-time miracle surgery. As of today, 9 children have had this life-changing procedure. Each one is a living testament to this new philosophy of creating, not just replacing. What's so amazing is that this whole modular philosophy, this way of thinking, isn't just for hands. These principles of precision microsurgery are being used to solve incredibly complex challenges all over the body.
For example, take the skip flap technique, which was pioneered by Professor Isao Koshima. It lets surgeons transfer these really precise sections of skin and tissue with their blood supply totally intact. And this one versatile technique is now being used to treat a huge range of problems, everything from lymphedema and scar contractures to really complex tumor reconstructions.
So, what does this all mean for the future? Well, what we're seeing here is more than just a new technique. It's a fundamental change in what surgery can achieve. It's transforming surgeons into, well, biological architects who can rebuild the human body using its own living parts. And that leaves us with a pretty profound question to think about. If surgeons can build a thumb from scratch, what are they going to build next? This kind of work is pushing the absolute boundaries of medicine, turning what was once a surgeon's impossible dilemma into an artist's canvas. The future is literally being built one tiny blood vessel at a time.